Have you ever woken up in the middle of the night and your child feels burning hot? Your heart starts racing, your mind jumps to worst-case scenarios, and suddenly it's 2:17 a.m. and you're Googling symptoms in the dark. Mom, take a deep breath. Hi, lovely mom. Welcome to Calm and Ready, where we stay prepared without panic and handle real-life chaos calmly. Let's get into it. I'm going to walk you through exactly what to do when your child has a fever at night, calmly, confidently, and without panic. Because being ready doesn't mean being anxious. It means knowing what to do. Section 1. First, stay calm. Before anything else, regulate yourself. Your child borrows your nervous system. If you panic, they panic. If you stay steady, they feel safe. Take one slow breath. Remember, a fever is usually a sign the body is fighting an infection. It's not the enemy, it's part of the immune response. So for most children, a fever is uncomfortable but not dangerous. So your first job as mom at 2 a.m. is not to fix everything. It's to stay calm and assess. Section 2. Check the temperature properly. Use a digital thermometer, ideally one you already keep in your
Let's just
bedside
check
drawer.
your temperature, sweetie.
Here's what counts as a
There we
fever.
go. Now
38
wait.
degrees Celsius, 100.4 degrees Fahrenheit or above. If your child feels hot, but the temperature is under 38 degrees Celsius, monitor, but it may not technically be a fever. Important, look at your child, not just the number. Are they responsive, drinking fluids, making eye contact, breathing normally? A child with 39 degrees Celsius who is alert and sipping water is usually less concerning than a child with 38 degrees Celsius who is lethargic and unresponsive. Trust both the thermometer and your mom instincts. Section 3. Make them comfortable.
Time for your
At
soft
night,
pajamas,
your
sweetie.
goal is
Okay,
comfort,
Mommy.
not
Arms up high.
necessarily
There we go.
eliminating the fever
Cozy.
completely. Here's what to do. Dress them in light clothing, use a light blanket if needed, keep the room comfortably cool, offer small sips of water. Don't overwrap them, use cold baths, rub alcohol on their skin. If they're uncomfortable, you may give age-appropriate fever medication like paracetamol or ibuprofen following correct dosage instructions. Pro tip for busy moms, keep a small fever kit ready. Thermometer, syringe or measuring spoon, fever medicine, notepad to track time given. At 3 a.m., you don't want to be searching cupboards. Section 4. When to worry. Now this is the part that helps you avoid panic. Seek urgent medical help if your child is under
Just checking
3
your
months old
temperature,
with
little
any
one.
fever, has difficulty breathing, has a rash that doesn't fade when pressed, is very drowsy or difficult to wake, has a seizure, has signs of dehydration, no tears, very dry mouth, no urine. For older children, a fever lasting more than 3 to 5 days should be checked. Otherwise, most fevers from common viruses settle within a few days. At night, if you're unsure, call NHS 111 UK for advice. You don't have to decide alone. Section 5. Overnight strategy. You do not need to wake a sleeping child just to give medication, unless advised by a doctor. Sleep helps healing. If they wake, recheck temperature, offer fluids, reassure them. Keep lighting dim. Keep your voice soft. Keep your movements calm. Remember, your steadiness is medicine too. Section 6. Aftercare the next day. In the morning, continue fluids,
Here you go,
allow
sweetie.
rest,
Thank you,
avoid
Mommy.
school or
You're welcome,
nursery
my love.
until fever has settled. And most importantly, give yourself grace. Night fevers are exhausting. You handled it. You stayed present. That matters. Being ready doesn't mean expecting the worst. It means knowing what to do when something normal, like a fever, happens at an inconvenient time. You're not overreacting. You're not underreacting. You're learning, and that's powerful. If this made you feel calmer, follow @CalmAndReady for simple readiness tips for busy moms, because prepared doesn't mean panicked.